Hello and welcome back to our channel. Today, we're diving deep into a critical topic that affects millions of people worldwide: stomach cancer. Understanding the symptoms of stomach cancer can be a lifesaver, as early detection is crucial for effective treatment. In this video, we'll walk you through the early warning signs, risk factors, and when you should see a doctor. So, stay tuned and don't miss a second of this important information. So, let's start with that. What is stomach cancer? Before we dive into the symptoms, let's briefly discuss what stomach cancer is. Stomach cancer, also known as gastric cancer, occurs when malignant cells form in the lining of the stomach. This type of cancer can develop in any part of the stomach and can spread to other parts of the body, including the esophagus, lungs, and liver. Stomach cancer is the fifth most common cancer worldwide, with over 1 million new cases diagnosed each year. It is more common in older adults, with the average age of diagnosis being around 68 years old. Men are more likely to develop stomach cancer than women. There are several types of stomach cancer, but the most common is adenocarcinoma, which begins in the glandular cells of the stomach lining. Other types of stomach cancer include lymphoma, which begins in the immune system cells; gastrointestinal stromal tumors, GIST, which begin in the cells of the stomach wall; and carcinoid tumors, which begin in hormone-producing cells. Each type of stomach cancer has different characteristics and may require different treatment approaches. Now we will discuss the early symptoms of stomach cancer. Early detection of stomach cancer is often challenging because the symptoms can be subtle and easily mistaken for other common gastrointestinal issues. However, there are some early signs that you should be aware of. Number 1. Indigestion and heartburn. Persistent indigestion and heartburn that do not go away with usual treatments can be an early sign of stomach cancer. If you find yourself frequently reaching for antacids, it might be time to see a doctor. These symptoms occur because the tumor can cause irritation and inflammation in the stomach lining. Number 2. Stomach pain. Pain or discomfort in the abdomen, particularly in the upper part, can be a warning sign. This pain might be dull and persistent, or it could come and go. It is often mistaken for a peptic ulcer or other less serious conditions. Number 3. Nausea and vomiting. Experiencing nausea and vomiting, especially if it's persistent, can indicate an issue. In some cases, vomiting blood might occur, which is a clear sign that immediate medical attention is needed. Nausea can result from the tumor obstructing the normal function of the stomach. Number 4. Bloating. Feeling bloated after eating a small meal can be an early symptom of stomach cancer. This bloating can be uncomfortable and persistent. It occurs because the tumor can interfere with the stomach's ability to process and empty food properly. Number 5. Loss of appetite. A noticeable decrease in appetite, particularly if it leads to significant weight loss, is a symptom that should not be ignored. The presence of a tumor can affect how full you feel after eating, even small amounts of food. Now we will discover the advanced symptoms of stomach cancer. As stomach cancer progresses, the symptoms become more severe and noticeable. Here are some advanced symptoms to be aware of. Number 1. Unexplained weight loss. Significant and unexplained weight loss is a common symptom of advanced stomach cancer. This occurs because the cancer affects the body's ability to absorb nutrients. Additionally, a lack of appetite and the body's increased energy expenditure fighting the disease contribute to weight loss. Number 2. Fatigue. Persistent fatigue and weakness are common in advanced stages of stomach cancer. This can result from anemia, which occurs when the cancer causes bleeding in the stomach. Fatigue can also be a result of the body's ongoing battle against the disease. Number 3. Vomiting blood. As mentioned earlier, vomiting blood is a serious symptom. This can appear as red blood or as a substance that looks like coffee grounds. The latter indicates that the blood has been partially digested, a clear sign of gastrointestinal bleeding. Number 4. Black, tarry stools. Stomach cancer can cause internal bleeding, leading to black, tarry stools. This is a result of blood being digested and is a clear sign that medical attention is needed. The presence of melena, or black stools, is often an indication of upper gastrointestinal bleeding. Number 5. Difficulty swallowing. As the tumor grows, it can obstruct the passage of food through the stomach, making swallowing difficult and painful. This symptom, known as dysphagia, is particularly common when the cancer is located at the junction of the stomach and esophagus. What are the risk factors for stomach cancer? Understanding the risk factors for stomach cancer can help you determine if you are at a higher risk. Some of the main risk factors include: Number 1. Age. Stomach cancer is more common in people over the age of 50. The risk increases with age, and the majority of cases are diagnosed in people in their late 60s and older. Number 2. Gender. Men are more likely to develop stomach cancer than women. The reasons for this gender disparity are not entirely clear, but may be related to lifestyle factors and differences in exposure to risk factors. Number 3. Diet. Diets high in salty and smoked foods and low in fruits and vegetables can increase the risk. Consuming large amounts of processed meats, such as sausages and hot dogs, has also been linked to an increased risk of stomach cancer. Number 4. Smoking. Smoking increases the risk of stomach cancer, especially cancer in the upper part of the stomach near the esophagus. The harmful chemicals in tobacco smoke can damage the cells lining the stomach. Number 5. Helicobacter pylori infection. This common bacterial infection can cause chronic inflammation and increase the risk of stomach cancer. H. pylori infection is a major risk factor for stomach ulcers, which can eventually lead to cancer if left untreated. Number 6. Family history. A family history of stomach cancer can increase your risk. Certain genetic conditions, such as hereditary diffuse gastric cancer, HDGC, and Lynch syndrome, also heighten the risk. Number 7. Previous stomach surgery. People who have had surgery to remove part of the stomach are at an increased risk of developing stomach cancer. This is because the surgery can lead to changes in the stomach environment that may promote cancer development. Number 8. Certain medical conditions. Conditions such as pernicious anemia, where the body cannot absorb vitamin B12 properly, and chronic gastritis, an inflammation of the stomach lining, can increase the risk of stomach cancer. If you face these issues, when to see a doctor? It's essential to know when to seek medical attention. If you experience any of the symptoms mentioned, especially if they persist or worsen, it's crucial to see a doctor. Early diagnosis and treatment can significantly improve the chances of successful treatment. Don't ignore persistent gastrointestinal symptoms, even if they seem minor. Many people delay seeking medical help because they believe their symptoms are due to less serious conditions like indigestion or ulcers. However, getting checked by a healthcare professional can provide peace of mind and ensure that any serious conditions are caught early. Diagnostic tests for stomach cancer. To diagnose stomach cancer, doctors may use a variety of tests and procedures, including: Number 1. Endoscopy. This involves using a thin, flexible tube with a camera to look inside the stomach. Biopsies can be taken during this procedure. An endoscopy allows the doctor to directly visualize the lining of the stomach and take tissue samples for further analysis. Number 2. Imaging tests. CT scans, PET scans, and X-rays can help doctors see if the cancer has spread. These imaging tests provide detailed pictures of the inside of the body and can reveal the presence of tumors and their exact location. Number 3. Blood tests. Blood tests can check for anemia and other signs of stomach cancer. A complete blood count, CBC, can reveal if you have a low red blood cell count, which can indicate bleeding within the stomach. Number 4. Upper GI series. This is a type of X-ray test where you drink a barium solution that coats the stomach lining, making it easier to see abnormalities on X-rays. It can help detect tumors and other abnormalities in the stomach and upper digestive tract. 5. Laparoscopy. This surgical procedure involves making small incisions in the abdomen and inserting a laparoscope, a thin tube with a camera, to look at the stomach and surrounding organs. This can help determine the extent of the cancer and whether it has spread. 6. Biopsy. During an endoscopy, the doctor may take small tissue samples from the stomach lining. These samples are then examined under a microscope to look for cancer cells. A biopsy is the most definitive way to diagnose stomach cancer. Treatment options for stomach cancer. Treatment for stomach cancer depends on the stage of the disease and the patient's overall health. Options include 1. Surgery. This is the most common treatment for stomach cancer. It involves removing part or all of the stomach and sometimes nearby lymph nodes. The type of surgery depends on the location and extent of the cancer. In early-stage cancer, a partial gastrectomy may be performed, while advanced cases may require a total gastrectomy. 2. Chemotherapy. This treatment uses drugs to kill cancer cells. It can be used before surgery to shrink the tumor or after surgery to kill any remaining cancer cells. Chemotherapy can be given intravenously or orally and is often used in combination with other treatments. 3. This uses high-energy rays to kill cancer cells. It's often used in combination with chemotherapy. Radiation therapy can help shrink tumors and reduce the risk of cancer recurrence after surgery. 4. Targeted therapy. These drugs target specific aspects of cancer cells and are often used when stomach cancer is advanced. Targeted therapies can attack specific proteins or genes involved in the growth and spread of cancer cells, minimizing damage to healthy cells. 5. Immunotherapy. This treatment helps the body's immune system fight cancer. It's used in certain cases where other treatments have not been effective. Immunotherapy can boost the immune system's natural ability to recognize and destroy cancer cells. 6. Palliative care. For advanced stomach cancer, palliative care focuses on relieving symptoms and improving the quality of life. This can include pain management, nutritional support, and psychological counseling. Preventing stomach cancer. While it's not always possible to prevent stomach cancer, you can reduce your risk by making healthy lifestyle choices. 1. Eat a diet rich in fruits, vegetables, and whole grains. Avoid salty and smoked foods. Incorporate a variety of colorful fruits and vegetables into your meals, as they contain antioxidants and other nutrients that can help protect against cancer. 2. Quit smoking. If you smoke, seek help to quit. Smoking increases the risk of many types of cancer, including stomach cancer. There are numerous resources available to help you quit, including counseling, medications, and support groups. 3. Limit alcohol. Drinking alcohol in moderation or not at all can reduce your risk. Excessive alcohol consumption is linked to an increased risk of several types of cancer, including stomach cancer. 4. Maintain a healthy weight. Being overweight or obese increases the risk of many cancers, including stomach cancer. Engage in regular physical activity and follow a balanced diet to maintain a healthy weight. 5. Regular checkups. If you have risk factors for stomach cancer, talk to your doctor about regular screenings and checkups. Early detection through screening can catch cancer at an early, more treatable stage. 6. Treat Helicobacter pylori infection. If you have an H. pylori infection, getting it treated can reduce your risk of developing stomach cancer. Antibiotic treatment can eradicate the infection and reduce inflammation in the stomach lining. 7. Limit processed meats. Reducing your intake of processed meats such as sausages, hot dogs, and bacon can lower your risk. These foods contain preservatives and other chemicals that have been linked to cancer. 8. Stay informed. Keep yourself updated on the latest research and recommendations for cancer prevention. Knowledge is power, and staying informed can help you make healthier choices. If we talk about the conclusion, stomach cancer is a serious disease, but understanding the symptoms and risk factors can help you catch it early. If you experience any of the symptoms we've discussed, don't hesitate to see a doctor. Early detection and treatment are key to improving outcomes. Thank you for watching. And don't forget to like, subscribe, and hit the notification bell for more important health information.